Hello, everyone. Thank you so much for having me. I would like to thank the organizers. I will be speaking in English because I left Iran when I was almost 6 years old. So hence my Farsi might not be up to date to be able to have this presentation in Farsi. I know everybody is tired, so I'm going to do an exercise for us to kind of wake up so we can really understand what healing is about. So I would like everybody to close their eyes. For a moment, I want you to close your eyes and take a deep breath. Okay, doctor. Close your eyes. Think about everything you've been through, the struggles, the loss, the moments where you felt like you couldn't go on. Now think about how strong you have to be to make it here today. Now I want you to gently wrap your arms around yourself. Give yourself the kind of hug you would give a dear friend who needed comfort, because you deserve that too. Breathe in. Feel your own warmth. Let this be a reminder that no matter what you've been through, you are still here. You are still standing. Now, as you open your eyes, remember, healing starts with self-compassion, but it doesn't have to be done alone. We can all heal together. Thank you for this. Thank you for trusting me. What if I told you, instead of being broken by trauma, we needed to rebuild a nation stronger, freer, and unafraid? What if I told you it's possible? Would you believe me? What if I told you that it has happened before? In South Africa, like Dr. Allen mentioned, truth and reconciliation efforts help a nation to rise from apartheid. In Rwanda, country that was torn by genocide, found a path through healing, through community justice and trauma recovery. In Chile and Argentina, survivors of dictatorship, exactly like the Islamic Republic of Iran, they reclaimed their voices and built a movement that demanded justice to ensure that history would not repeat itself. You might think that is impossible, but history has shown and proven that collective healing can transform a nation. And now it is Iran's turn to heal. And you might think, why is this important? Well, you will learn during this presentation why it's important that we collectively start healing so we can reach a greater place. And we have learned from other countries, other regimes, that it is possible. So, during this presentation, I will talk about how initiatives, community-driven approaches to trauma recovery, focusing on resilience, education, and public health can help our nation, our beloved Iran. As was mentioned, I founded Iran House. Iran House is a place for survivors of torture to seek healing, because all of us need a home to heal. Hence why Iran House was created. Hence why I felt that I needed a home, because as you all know, we are all, as I always call it, we are unicorns of trauma. We have a trauma of generational trauma, of migration trauma, of the fact that we are mourning of a country that we no longer can return to. So with this program, that we're going to address the psychological wounds that our nation is actually experiencing as we speak. Sorry, let me just bring up. So the psychological wound that the Islamic Republic has inflicted for the past 45 years. We are going to also talk about how structure this culturally, because as we all know, Iran is a rainbow of different cultures, different customs, different, we have Baluchistan, we have Kurdistan, we have Azerbaijan. All of them bring it to make it what Iran is. And that we need to honor, we need to restore, and we need to give them platform to be able to heal in their own way, with their own language, with their own customs. It is very important for us to be able to provide that for the Iranians inside of Iran. Promoting a collective healing. Collective healing comes from a place of trust. You know how you guys trusted me by closing your eyes? Although some people trusted me by closing their eyes. That comes because we don't trust. We don't trust one another. We don't trust our government. We don't trust ourselves sometimes. So having a program to be able to infiltrate this into different parts of the society is very important for healing. So what are some of the problems we all know? We know that what's happening in Iran, we all know the problems. We all know the suffering. But we also know that there is a very high PTSD and psychological distress, especially in marginalized communities, especially in women, especially in LGBTQ population, especially in children. We also know that the disproportionately impact marginalized groups because they don't have the same access as they would in big metropolitan cities. And not only that, they don't have the access, sometimes they don't have the means to be able to pay for it. Youth mental health crisis. I think it's been mentioned that unemployment rates are so high. And that unemployment rate, not being able to provide for yourself, not being able to provide for your family, does tear away your mental health, takes away the hope for future, for hope for tomorrow. Systematic and structural barriers, that is also another problem, that in urban cities, they don't have services. They don't have access to it. And not only do they have services, there is a stigma associated to mental health. When they hear mental health, they think you need to be crazy to be able to seek help. Government censorship. We all know that the government, if they provide you with healing, if they provide you for a psychiatric institution, they just want to take you there to condemn you of what you want or the kind of freedom you deserve. So they're not really the institution of healing. They're an institution for you to be punished. And then neglected suicide and addiction crisis. I don't know, since the start of Mahsa Jina Amini movement, which I started focusing on Iran by providing mental health, I have seen such a rise in suicide. And a matter of fact, the reason I wanted to focus on survivors because I got a tweet on Twitter. Somebody tweeted that they wanted to kill themselves. And unfortunately, I could not save that person after 6 hours of being on the phone with them. Why? Because they had lost hope. Hope in themselves, hope in the government, hope in the future. And this is something that they are facing on a daily basis, which can be prevented. Cultural and economical stressors. Yesterday, I talked to one of my clients, said, I haven't had meat for over a year. And right now, the cost of meat, who knows what's the cost of meat in Iran right now? Raise your hand if you know. It's 1 million per kilo. 1 million. And you know what her, how much she makes? She makes $150,000 to be able to clean houses. And she has 2 people that she needs to support. So if that's not trauma, if that's not what we need to heal our nation, I don't know what else it is. Also, this economical hardship brings chronic stress. She can't function as a member of society, as a mother, when she doesn't know when her next paycheck comes from. And this is not just one case. This is majority of people, what they are struggling, because middle class doesn't exist anymore in Iran. And then low mental health literacy. thinking that if I seek mental health, that means that I'm crazy. A lot of people don't want to talk about it because they think if I don't talk about it, the magic word is going to disappear. So the good news is there's a solution, and we know that it's been working in other nations. So the solution is for us to be able to train local leaders and professionals about what healing is, what trauma work is, and also be able to help them to install trust by being transparent, because transparency is something that we are not used to in the Iranian culture in Iran. And then support the families of survivors, being able to have a place for them to go and seek justice, seek support. And the reason I'm saying justice, because that is so goes hand in hand with healing. One of the things I do, I take survivors with me any opportunity I get. I couldn't bring them here, but because once they tell the story, they start to heal. Because why? It's not in the dark anymore, is in light. The trauma is being heard. And when we validate, when we give them that, oh my God, that's when they start to heal. And that is very important for them to be able to have places that they can go to, all of them, so they have something in common, the pain that they have in common. Public awareness and stigma reduction, to be able to have national campaigns on what it is. In the United States, 1-800-SUICIDE is accessible to everybody. We even have a hotline for LGBTQ. And why can't we not have that for Iran? And then another thing that we need to do with this is to have mobile mental health services, meaning that we set up different cars, or by cars I mean vans, that they can be in different rural areas when people cannot travel or do not have the money to be able to pay for those mental health services, and we can go to them and invite them to join us. So this model support, I put all the people that support, but it does support everybody. And it's very important for us to be able to have this model in schools, more important, in our education system. Because the education system in Iran it's very obviously very different. But one thing that in Iran we are taught from a young age to be very familiar with our anger. Anger is a way we express ourselves in Iran. Because why? That's what we see around us. That's what we see on TV. That's how our parents interact with us. Believe it or not, this program, we started this in 2021. And this is the train model, meaning that we train people inside of Iran and outside of Iran, and then they go and train other people to be able to make this a global initiative. And as you can see, so many people have already been benefiting from this program. So there is a timeline. In the 3-year timeline, we're going to first focus on community-based mental health services. Then 2026, public awareness and stigma reduction. And then 27, mobile mental health services. And this is the part that is tricky. We need $3 million and some change to be able to do this. And the reason this has been successful, because we have done fundraising so far for around $500,000 to be able to help those people. But it doesn't stop there. And I'm going to share something, why this is important. It's a message for one of my clients that I want you to hear why and how people are feeling right now inside of Iran, and why healing is so important to them.
سلام آزاده خانم، خوبی؟ سلامتی؟ من اگه یادتون باشه چند وقت پیش خیلی زخمی شدم، چاقو خورده بودم. خب بعضی از چاقوها جوری بود که عمیق بود، یعنی معدم معلوم میشد. خب الان از داخل عفونت کردن، عفونت داخلیه. شما خوبین؟ سلامتی؟
So when I say we need healing, this is very common what's happening. He was saying that hi آزاده خانم سلام. صداش میدونستین که در نمی اومد. چاقو خورده بود به خاطر رژیم، گرفته بودنش. چاقو انقدر بدجور خورده بود که چند وقت تو بیمارستان بود و الانم چرا باید برگرده به زندان؟ 2 ماه بهش وقت دادن هیل بکنه، باید برگرده زندان because why? He wanted freedom. And if he doesn't برگرده ایران، برگرده زندان، باید 2 میلیارد تومان پول اون یه چیزی گذاشته که باید بده. Those things I don't know فارسی چی میشه؟ وثیقه. So, on that note, I want to thank you guys for taking this moment to hear why healing is important, why collective healing is important. Because what's happening here is not just me versus them. It's us. اون مایی هستش که امروز همش صحبت کردیم و ما باید همه با هم بتونیم دست به دست بدیم و این پروگرام ها رو ایمپلمنت بکنیم که کشورمون بتونه اون پتانسیلی که داره رو به دست بیاره. Thank you so much.